broadcasting from the Nelson & Nelson building, and today we are excited to welcome to the studio May Lample. She is the Community Health Mobilization Coordinator for Southeastern Health. Welcome.
Thank you.
And we also have Sarah Gray with us. She's visiting from the Robeson County Health Department, and she is the Health Education Supervisor there.
Thank you.
So we're going to be talking about the Community Health Needs Assessment today, and this is something that is a large undertaking as I understand it, and lots of partners and people involved, but the results are very important to the improvement of the health of this community and so the people that we serve. So May, I'm going to start out with you and ask you if you would introduce yourself and tell us a little bit about your background and how long you've been with Southeastern, and then we'll meet Sarah and we'll go into the Community Health Needs Assessment.
Sure. So like you were saying, I'm the Community Mobilization Coordinator at Southeastern Health in the Community Health Services Department. I've been there for about 8 months, so I'm relatively new to the area and to this job. I've sort of been in different places. This is my first time living in North Carolina, though I moved here from California, and it's been really nice so far.
Great, great. Sarah, if you would tell us a little about yourself.
Okay, I'm Sarah Gray with the Robeson County Health Department, and I just started actually a month ago, but I was employed at Robeson County Health Department probably maybe 10 years ago. Mm-hmm. And then I went to work in Columbus. But even when I was in Columbus, we were still working with Robeson County Health Department, so I feel like I never really left. But I am originally from Whiteville. But I'm happy to be back in Robeson County.
Wonderful. So what is the Community Health Needs Assessment? What is that? What does that mean?
So the Community Health Needs Assessment is a tool that we use in order to help direct the activities of the health department and of the hospital, our community health related activities. We really use two methods mostly through surveys and focus groups, and it really helps us get the opinion of the community. It's really a community-driven process.
Mm-hmm. So why do we do? What's the history, the background?
Well, this has been a part of public health for a long time. And so one of the things that this helps us is to determine what is going on in the community in terms of health needs. And it allows us to identify maybe what programs people may want or interventions to help the community become stronger and healthier. Mm-hmm. So some counties repeat this process every 3 years, some every 4 years. It just depends on where you're at. Mm-hmm. But this is an integral part of public health. So,
and it's also a requirement, is it not, for the health department for?
It is for accreditation standards, but it's also a requirement for the hospital as well.
Right, right. And so what role does that play as a requirement for the hospital? Is it for community benefit?
It's for, part of community benefit for the IRS, to register as a nonprofit. Yeah.
Okay. Mm-hmm. So we are partners both benefiting as a requirement and as a way to gather information to help improve health.
Right.
Exactly.
Right. Okay. So who participates? I know we'll be talking about the focus groups a little later, and you've ventured out beyond Robeson County, but I believe that Robeson County is your primary focus point. So talk a little bit about who participates in this assessment.
So the assessment is really for people who live and work in Robeson County. Mm-hmm. We're fortunate to have several partners who are helping us reach out to the people that participate in their organizations. So we have United Way, Robeson Healthcare Corporation, the Lumbee Tribe, the library has been helpful, the Maxton Chamber of Commerce, the Housing Authority, East Point, Wesley Pines. Those have been some of our key partners.
Wonderful. So how does the process work? So I guess we should start with the survey as a component.
Mm-hmm. We're trying to decide who's going to answer. Sorry. So the process works by, usually there's a task force formed, and in this case in Robeson there is a task force, and what they do is they come up maybe with a set of questions, or sometimes they reuse the same questions that have been used previously to ask residents about their opinions about what's going on in terms of health in the community. So that task force kind of guides the whole process. So again, in terms of Robeson's survey, there's not as many questions, but that's actually a good thing because we don't want to burden people with a 50-page survey.
Absolutely.
It's just a one-page survey, and it's very general questions that are easy to understand and to answer. So,
What's an example of a question that might be on the survey?
what do you feel is the most prominent health issue, or what do you feel are the most areas of health concerns?
And so they're open-ended
county.
questions. They're not like multiple choice or
Some of them are,
okay.
yeah. Some of them are multiple choice, and some of the questions you can actually respond by picking more than one answer.
Okay.
That it indicates those questions that you're able to do that, or that we ask people to do that.
So are the surveys disseminated through your partners in this task force, and they take them out? Are they available by picking one up at the health department, or how would a person who may be interested pick to do the survey? How would they find one? May?
So our first stage of distributing surveys has ended. There's potentially, we might have people distribute, we might distribute some more in order to really make sure that we're capturing a wide array of audiences. But we were primarily going through partners, and then having our partners really focus on distribution.
So
and
any
reaching out.
public that they come in contact through their normal work, they would have a survey available for them.
Right.
Are they mailed out to, or not
We
necessarily?
don't use mail just because the return rate is usually pretty low. So
Yeah.
really, it's just having points of contact through the task force or different agencies that are working together on this. But if anyone's interested in participating or filling out a survey, they can certainly call May or myself, and we can get them a survey.
Would you share those phone numbers with our listeners?
So mine is 671-3221, and
Okay.
that goes directly to me,
Sarah Gray at the health department.
Sarah. Yeah.
Okay. May?
My number is 272-1177, and that
Okay.
goes directly to me.
Okay, and that's May Lample. So the biggest portion of the survey has been done. So now what's next?
So next is a time where we bring the task force back together, and we help go through, analyze the results. So we identify priority areas, and we begin to put the needs assessment together and create action plans.
Okay. Now there is another component of the focus groups. So those I know have been ongoing and will be done by the time our listeners are hearing this. But what is the purpose of the focus groups?
So the focus groups is just another way of being able to hear directly from people. So it's a looser format than a survey, so people can answer they're more open-ended questions. It's an opportunity to hear directly from people. We ask similar questions like, can you identify some health needs, some health concerns in the community, but we can talk more in depth rather than short answer questions.
And that is a part of this that UNCP students have helped with, is that correct?
Yeah, we were able to fortunate to have UNCP students help us organize 3 of our focus groups in Lumberton, Pembroke, and Fairmont.
Great, great. So you have gathered all your information, your partners have gotten together, going to analyze the information. So do you predict what you think they'll say, or do you have an idea based on years past? Are there any trends? I guess maybe you could start talking about, I know you're new, so Sarah, maybe you need to get this question since you've been here. Of course, you're both sort of new, but you're back.
Right.
Or either of you can chime in, but what do you have been the trends?
I will tell you, we do see trends, and this is not just unique for Robeson County. This is, can be applied to most counties in North Carolina. We do see trends, especially around like chronic diseases, obesity, and substance abuse or misuse. So those are kind of what I call like the hot items. Now, we haven't started, analyzing all the results yet. However, I would be surprised if those three things were not at the top, based on what we've seen in the past. The
Local trends, national trends.
The one caveat to that is, Hurricane Matthew and what the residents faced here with that. So that could change some of the survey results just because that is so pressing in people's minds still, as it should be. So that's one thing, I've thought about. I don't know that will occur, but that's just one thing that I have thought about that could maybe change a little this time as we go through the process.
Okay. So once you have analyzed your data, and then what do you do to start to address those issues as they come up?
So the action plans I was mentioning are one of the main ways. So that really determines what are our next steps. What are we going to do in light of all the information that we've received with people expressing their concerns? So we begin to create steps in which to address these issues. So in the past, as Sarah was mentioning last time that we did the needs assessment, one of the main issues was obesity. So we wanted to encourage physical activity and nutrition. So there was an effort to create these walking trails around the schools. So similarly, after we analyze the results, we would create a plan of action so that we can begin to address these needs in our community.
Okay.
And there's also we prioritize some of these issues because, and the reason why is some of them we may not have the capacity to address, meaning we may not be able to bring all these economic opportunities into the county. However, we do hear that residents have that concern. So we would either have to latch on to existing resources, meaning community members that are already focused on that issue, or just say, let's focus on these things that we know we have the capacity to address at this time. So.
Very interesting. So what's your return rate, going back to the surveys? Do you have a pretty good response rate for the surveys?
So our goal is to have over at least 50%. So we've exceeded that goal, but we know that we can do better because we've done better in the past. So last time we had about like 80% return rate. Right now we're at about 60%. So we know that we can do even better.
Wonderful.
Yeah.
So is this a 3-year process, 3-year reoccurrence for us?
It is.
Okay. And so I guess it can fluctuate. 3 years can be a long time when you're talking about health trends. So like in 3 years, it may be a completely different set of issues.
It could be, yes. Yeah. That is something that could occur.
Yeah.
So, but I will be honest with you, and I'll tell you from what I've seen. I mean, I think this is my 16th year in public health, and usually with the trends, especially with the community health assessment, when you're talking 3 to 4 years out, you may not show much change there in terms of health issues, health concerns. But when you look at 10 years out, there could be a bigger difference.
Okay. So are you ever looking to recruit partners for this task force, or do you pretty much have the players that you need, or is that something that you're open to accepting?
Yeah, I mean, the task force is also made up of people who participate in the Healthy Robeson Task Force, which is a task force that's always open to new members and that does things and gets together beyond just the community health needs assessment. We've been given, the hospital has received a grant this year to help reinvigorate that task force. So organizations that are interested in joining are most welcome to do so.
Okay. So, Sarah, what do you see as like the health department's like number one priority as related to this community health needs assessment from a health department perspective?
Well, I mean, it's. I don't want to speculate too much because we haven't started analyzing all the results. But for our role is to address the most pressing health issues. So, in years past, with chronic disease prevention, and really it was more tailored to type 2 diabetes prevention. We really geared up our efforts there to try to help residents understand the disease better, but also to help prevent the onset of the disease. But we're still looking at a lot of those chronic conditions that people suffer from in this county: heart disease, some types of cancer, obesity, stroke, diabetes, type 2 diabetes, all these things that we know can be prevented just by the lifestyles that we may or may not choose to live. So I think from the health department's role, it's really looking at what we can do, what we know works in communities that will make the biggest improvement for population health.
Yeah, so I would think that it would be quite a task for people to change their lifestyle. So you mentioned, it's going to take some time to measure it. You can't overnight, people aren't going to stop smoking overnight or start walking when they don't. I mean, that's the process of education and showing results that's going to take some time.
Right. And, I always say if you can just get people thinking about these things, that's really the first step. Even somebody thinking to themselves, man, I probably shouldn't have that third cup of sweet tea today. Maybe I could switch it out for water.
Yeah.
Even just the small steps of just thinking about things like this, thinking about change, are really where it all begins. So if we can do that, that's really a huge accomplishment in itself.
And I know Community Health Services, the Department of Southeastern Health, has a number of resources. As I think about this conversation of lifestyle changes, I think about children and starting in the schools. And I know that we have a number of programs where we go in the schools and start to teach children about healthy eating and those types of things. So if you would touch on a little bit of the programs that Community Health Services offers that is also working in conjunction with all these other partners programs to help try to move this needle.
Yeah, so just as you mentioned, we're fortunate to have a nutritionist on staff who's been working hard to get into the schools and try to provide nutrition education in elementary and middle schools throughout the county, and really encourage young people, kids, to be conscious of what they're eating, get them excited about eating fruits and vegetables. Right now they're learning, when she goes into the classroom, she's teaching them about the different fruits and vegetables and what they do for the body. And it's a great opportunity because really when we're talking about behavioral change, the earlier we can intervene, the better. Because these habits that we pick up from when we're young become harder to change when we're older. So that's really been crucial and been an exciting step in our department. Then we also have the Community Health Education Center, which is located permanently in Biggs Park Mall, and that's a place that people can go in order to get resources there. And then also we have physicians and various providers who come and speak there and who are happy to answer people's questions.
So you have free literature.
Free literature
people can come
there.
And check their blood pressure and their weight on your machine. So that's a good resource. I know you have probably lots of mall walkers who know about that, but the community in general may not realize that there's basically a free health information library available right there in Biggs Park Mall. And if you go in the main entrance there by Shoe Show, it's the right past Shoe Show. So it's a great resource offering the lunch and learns or the breakfast at Biggs Park Mall where people can actually interact with providers and say, well, I've heard about this new doctor, but I don't know. You have an opportunity to actually meet with them face to face and to get to know them. So, and then you also have the WOW bus. And so that actually can take help to people in their community. So tell a little bit about that.
So the WOW bus lets us, it's basically a mobile van that helps us bring some of these health screenings that I was talking about to various locations in the community. So the WOW bus is something that if people are having an event and they want to have us come and do screens, that we bring the WOW bus and we offer the screening. So
sort of like a mobile classroom.
Exactly.
Classroom almost. And if you're interested in any of these programs that May has been talking about, The general number to Community Health Services is 910-671-5595. You can call that number and get more information if you want to check on booking the WOW bus, or if you want to know about getting some programming in your school, that sort of thing. So they can help you out with that information. So we're getting ready to wrap up, but I wanted to let the community know, how can they hear about the results? Do you post those publicly, and how can people find out if maybe they participated in the survey and they wanted to find out what other people said, or maybe just people in general interested in what people think the trends are in the community? How can they find out more information? Sarah?
So after we complete the health assessment process, typically we do press releases. It is posted on the health department website as well as the hospital website. So those are two main ways. But also we in the past have tried to distribute them to the local libraries, making sure that they have a copy. And if people actually want a paper copy versus an electronic copy, then we'll be happy to accommodate them. They can call the health department. We'll be happy to help them with that.
Great.
Or call May.
Yeah, definitely.
May will be happy to assist
Great.
as well.
So is there anything we have not touched on about the Community Health Needs Assessment? I guess we'll be visiting with you all in 3 years when you start this process all over again. It sounds like a very interesting project, and one that is used as an important tool to guide a lot of planning for health for this community. So thank you both for being here. We've had as our guest today Sarah Gray, Health Education Supervisor for the Robeson County Health Department, and May Lample. She is the Community Health Mobilization Coordinator for Southeastern Health. So thank you both for being here, and we look forward to hearing more about what people think the needs are of health in Robeson County and how we're going to put our action plans in place to confront that. So thank you both for being here.
Thank you very much.
Thank you for joining us for Southeastern Health's Healthy Connection.